So my name is Dr. Daniel Leonard. I'm a board-certified pediatrician in Hastings, Nebraska, working at the Children Adolescent Clinic and Mary Lanning Healthcare. A lot of parents ask me to justify vaccinating children for COVID-19 when historically, and only by historically I mean only a couple of years, we have not seen as severe acute disease or death in children, thank God. What I remind those parents of is the unforeseen, unanticipated long-term effects of COVID via natural disease and wild-type infection. And we're starting to see that clinically. It is at least one day a week I take care of a patient in clinic who has had COVID either a couple months ago, a year ago, and now we're dealing with the fallout of that. Reactive airway disease or childhood asthma. I'm seeing elevated liver enzymes and abnormal liver function testing in children. We're seeing immune suppression with decreased white blood cell count and a decreased propensity for fighting every other infection. And, we don't have a causative reason for this yet, but we're still looking into it. At the height of the pandemic, everyone was concerned with this multi-system inflammatory process in children, which was terrible. But now we're starting to see the fallout of what happens later on if you get wild-type COVID. What I really want to underscore for parents is that this is our knowledge of something occurring later, a long-term side effect from acquiring a disease is not new. In the 1930s, we identified the mumps virus. We recognized what the clinical symptoms were. We had a good idea on how to prevent it. It wasn't until about a decade later that we looked back and saw that nearly a third of males who had mumps as toddlers were rendered sterile as adults. That took a decade to discover. Let's not let another decade go by before we determine the importance and the necessity of vaccinating children to prevent wild-type disease altogether, if not for acute illness, for the long-term effects. This was replicated in the 60s with RSV. We now know, since second half of 20th century, that people who acquire RSV before their second birthday, nearly a third end up with childhood asthma. Take a survey of parents in a classroom. Probably half of them are going to raise their hands and say that their kid had RSV and that they dealt with one problem or another thereafter. So we have history, we have data, we have precedent for this, and we have reason to be worried about how this new novel virus might lead to long-term effects. And it is our duty, it is our responsibility to children to prevent that from happening and not have a cohort of kids who serve as an example to convince the other people to vaccinate.